Okay, surgical menopause, you're a raggedy girl. Sorry, I can't say the B word. I'm not a woman easily given to swearing. But, oh my God, thank you guys so much for engaging with this menopause and perimenopause content. I love teaching it, and it makes me feel so happy that you guys are learning from it as well and enjoying it as well. So yeah, thank you. Okay, serious business now. So what is surgical menopause? I was actually going to do this with S in our A to Z of menopause, but I had a couple of comments and I didn't want to leave them hanging. So this is just a brief one. I'm still going to do it with S. So what is surgical menopause? So surgical menopause is when we take out both ovaries before the age of natural menopause. So if it happens before 40, then we call it premature ovarian insufficiency or premature ovarian failure. And if it's after 40, then it's surgically induced menopause. It's important to note that both of the ovaries have to be taken out. If only one is taken out, or if you've had a hysterectomy but your ovaries are preserved, then it's not surgically induced menopause. There are studies to show that these women still go into menopause a bit earlier than they would have maybe like 2 or 3 years earlier with one ovary or with both ovaries intact but with a hysterectomy. Whereas with surgical menopause, the woman is plunged into menopause very suddenly and very abruptly, and that can be very jarring with symptoms and also with risks. I will talk about that more when we get to S. The reason surgical menopause differs from natural menopause is that surgical menopause is abrupt, whereas natural menopause is more gradual. So again, the hormones go like this, not like this, as with natural menopause. So this abruptization really causes very severe symptoms with the hot flashes, the night sweats, the insomnia, the mood swings. They're all very sudden versus happening on and off over a few years. Why do we even take out the ovaries in the first place? So most times both ovaries would be removed only when there's a concern for cancer. So with women with high inherited risks of cancer, especially ovarian cancer, but also with women with the BRCA1 and 2 genes. Those women usually get preventative surgery to take away their ovaries. So these women need hormone replacement therapy right after surgery and until the natural age of menopause. This reduces the risks that come with that sudden cessation of ovarian hormone production. And some of those risks include cardiovascular risks. Please look at the previous video on A to Z of menopause, cardiovascular health. That's C. On risks associated with that. But also cognitive function, so with like the brain fog and the memory things, and bone loss. So hormone therapy is very important in these women, and it's important to note that they usually need a higher dose of estrogen than women who have gone through natural menopause. So hope that helps as a band-aid. Again, we are going to discuss this a bit deeper when we get to S.